this is the third or fourth time that you.
I think it's gonna be the third time that I'm here with you. So
sure. So if Sean doesn't break things here, so he just covering his camera. Okay, so we are going to discuss the interconnected systems in United Medical. So as part of our one of the reasons that we do this, other than reaching out to patient and public, we also want to communicate with our employees and our providers who are utilizing our services. So that's part of the reason that we are having you guys giving us updates on RCM side. So you're on.
Of course. So no, thank you, Kemal. Thanks, El, for having me. As you mentioned, my name is Carlos Meinhardt, and I'm one of the associate directors for the RCM team here at United Medical. And I will be giving a brief overview of what the EMR is, the PM system, and QuickBase, and how these systems interconnect and interact with each other, and how our team uses these systems to run some of our day-to-day tasks. So I'll start with PowerChart. It's a hybrid electronic medical record solution that caters to clinicians, and it goes from small private practices to large hospital systems. PowerChart is designed to help with like multi-entity electronic medical record creation, and this solution can be hosted on the cloud, on-premise. I think another important aspect to highlight from PowerChart is that it coordinates the care between multiple locations and practitioners, and it helps the office staff manage medical record processes while still offering flexible documentation options. I think one prime example of this is how our United Medical ACO shares the same PowerChart domain and how it is useful for all our providers in our network. Now, I'm going to go over SPM, Kemal, unless you have anything to add on the PowerChart side. SPM, it is one of the PM systems that we manage and that we handle here at United Medical. It stands for Specialty Management System, and is part of the Cerner family of clinical practice management solutions. It is integrated with PowerChart, and it offers medical document management, patient appointment scheduling, and health record management. And one of the key aspects is like SPM is key to our RCM flow, as it allows us to submit claims to the insurance companies in real time after the patient is seen by the provider, pretty much. The other system that we use is CPM, in which we currently have 7 practices for a variety of specialties. We have from employer clinics, pediatrics, the surgery center, and a family practice. So it's another system that we also work with. And I'm going to quickly go over QuickBase and what it is. QuickBase is a cloud database software platform that creates custom applications that solve business challenges and that cater to the specific needs of the client or us in our case. And here at United Medical, we use it for client communication, productivity tracking, project management, and financial reporting, among other things. And Kemal, every time that we have this live sessions, I go back to one of the live sessions that we had together, refer to my notes, and I always go back to the time where you told us that QuickBase was not available when we first started. And as we started working with more clients and more specialties and more complex processes, it was something that was needed. I've been with United Medical for 8 years, and I cannot see United Medical without QuickBase. So it's an important tool that we use for here at United Medical. Next is how do these systems all interact with each other? And it all starts at the doctor's office. So patient goes through the patient registration and the insurance verification process by the office staff, and then the patient is seen by the provider. Then the provider documents all of this information and all of the visit information in PowerChart, and they add all of the CPT2 codes and diagnosis codes to the patient medical record. Then this information gets transmitted to our PM system, SPM, from the BMR, and after that, the office will go in and make sure that all the information that the provider added to the medical record is valid, and it gets entered into the patient's ledger. Our claim department then sends this information to the payer for payment. Now, there could be instances in which the payer, after we submit those claims to the insurance, may pay for the claim due to specific reasons. Sometimes it's billing errors. If the practice sends a visit with the incorrect CPT code or the incorrect diagnosis code, we could get a denial. And one of the examples that I provided in the slides that we have on the bottom is there's times when we get a denial from the insurance because incorrect diagnosis was sent, or a mutually exclusive diagnosis was sent to the insurance. In this instance, we do reach out to the provider using QuickBase to get the updated diagnosis information. So that's one of the things that we use QuickBase for. Another reason, I mean, after we submit the corrected claim to the insurance and we obtain payment, we also go ahead and post that information into our PM system, SPM. And at the end of every month, we gather all of the financial related information from the PM system and upload it into QuickBase. And that's another thing that I added in the slides, in which we gather all of our end of month reporting, which we then share with our clients during our end of month meetings. So that those end of month reports contain denial management information, along with all of the financial information data, but it's broken down by CPT, by date. So it just depends on the provider and what they're looking for.
So, Carlos, I actually tried to put this image on the, it's on the left side, right? So
Yeah.
on the screen. So between the three different systems, practice management, there are two of them, SPM and CPM. On the other side, we have our power chart, which what makes United Medical ACO and United Medical setup is unique is we have, it's called logical domain, which is there's one chart, one patient. So we have several different practices. They are owned by different individuals, but when it comes to the clinical integration, we are one organization. So although that's like everyone may say that they are using PowerChart, but there isn't any other healthcare organization in the United States is using this in the same setting that we are using. So that's extremely unique from that point. Now, one of the, I guess, the questions that we get from the clients, well, if the SPM or the CPM, if they are like so great, well, why do you need QuickBase, right? So, well, QuickBase actually, although it's kind of like the small box in this picture, well, we actually do almost business integration and some of our clinical integration in QuickBase, because one of the important part of business is standardization and unifying the way that we work, the policies, procedures, and how these things are available for different individuals in different levels. So the practice management system is going to provide the reports, the data for the reports, but the way that we mine those reports is not going to be ideal. So one of the things that we did in QuickBase is standardizing our monthly reporting, right? So that actually, while we were using that, we also use QuickBase for our internal communication with our tasks and our other projects. And then we added, on top of that, we added our client communication. On top of it, we add our population health management, our admission discharge process, and it just becomes it became like a pretty big deal right now. So the way that we are using, and it's not designed. Someone we program these. Myself, John Donnelly, and other individuals. You are part of some of the applications. We build it together. But between myself and John, we build most of the applications. Right now, probably John is better than me in terms of the building knowledge, but I can probably have more practical knowledge. So, but that's what makes it best. So then we can actually get the most out of the QuickBase, because it empowers UM and UM clients in a way that's that extra push that we are able to get. So then it becomes easier to standardize certain things for us, right?
Correct. Yeah, so it is very useful, and again, even from our internal management to assign different projects to our teams, especially for us on the billing side, the use of the different agent reports and the quad communication, it does make it very easy, and it's very helpful.
Absolutely. Now we also have we are using QuickBase for patient satisfaction surveys as well as the billing inquiries, which we did cover some of those in different sessions, different episodes of this event. So any feedback that you are getting from the clients in terms of their experience with the system?
I think everything's been positive, Kemal, especially with the different measures that we have internally, which we try to answer tickets after oral client communication after a specific amount of time. We're trying to stay on top of that, and I think it's the easiest way for our clients to get to us if they're not able to answer a question from the patient's ledger or anything like that. So overall, in what we see from the satisfaction surveys, everything's been positive. Everything's been, from the responses that we've seen, they all agree, and they all very thankful and appreciative of the system that we have in place.
All right. So anything else you would like to add, Carlos, before?
That's all I had, Kemal. I don't know if there's anything